Hi and good evening. Welcome back to my channel. It's Carrie and the Chemist here. And today I would like to talk about constipation. So what is constipation? Constipation is infrequent and or unsatisfactory defecation. It's actually going less than 3 times per week. Constipation is normally described as passing hard stool, straining to pass stool, incomplete defecation, and painful defecation. So what are some of the causes of constipation? It can be caused by medication, it can be caused by antidepressants and other sicknesses. It can be our diet if we're not having enough fiber in our diet. If we're not having enough water in our diet, we may experience constipation. So it's something that anyone of any age can experience. If you're having chronic constipation, remember to speak to your pharmacist about what laxatives are suitable, what is best for you. How can we prevent constipation? So we need to consume high fiber diet. For females, it's 25 grams of fiber. For males, it's usually around 38 grams, so it's a bit more. And we just want you to have at least a minimum of 10 grams per day of fiber. Drink fluids, so drink like 1500 mils of fluid daily. And if you incorporate products like food like fruits and drink juices that have sorbitol, so pear juice or apple juices or prune juices, those will help with constipation. So there are 5 basic groups of laxatives that we're going to talk about today, and those are our bulk forming laxatives, or emollients or softeners, or hyper-osmotics or osmotics, and our stimulants. So first of all, let's talk about bulk forming laxatives. So these are like your metamucil, which is psyllium fiber, and you normally measure at least a rounded teaspoon of this and add this to 250 ml of water or juice, and you drink it by mouth. Onset of action is usually 12 to 72 hours, and it can be taken daily and regularly. It can take 2 to 3 months for you to get maximum effect from these medications. It can cause some bloatedness and gassiness, so just be mindful of this. And it can interact with other medications, so give it 2 hours space between metamucil or psyllium fiber and your other medications. And there are the hypo-osmotic agents, and these include your glycerin suppositories. These usually work very quickly and they're inserted into the bum. You have glycerin suppositories for children and those for adults, and it's just inserted into the rectum. It's held there in place for about 15, and it usually works within 15 to 30 minutes, so very quickly. Lactoloss is also in this group, and this is taken by mouth. Onset is usually 24 to 48 hours, so a day or two, and side effects can include flatulence or abdominal cramps. Lactoloss is very sweet, but our diabetics, don't worry, you can take this one. It's not absorbed in the gut. It doesn't increase your blood sugar levels, okay? Interaction with lactoloss is also to be spaced 2 hours from your other medication. For PEG, which is polyethylene glycol, you will find these as Laxaday or Restoralax, and usually you use the cap on these bottles to measure the 17 grams. You add 17 grams to a glass of water or juice, and then you take it by mouth, and these usually work within an half an hour to an hour, okay? Then there are the osmotic agents, or magnesium hydroxide. Onset of this medication is like half an hour to 3 hours, and you can use this medication for constipation, but use it in caution in patients with renal impairment or cardiac issues. Then there is the stimulant laxative, and these are our senna and our bisocodyl. Onset of action is usually 6 to 12 hours. It can cause side effects as abdominal pain, dehydration, and senna can discolor your urine to be a reddish brown color. Bisacodil will interact with milk or antacids, so make sure you're avoiding these products with bisacodil or spacing it 2 to 4 hours. With senna, senna comes as a liquid or a tablet form. Onset is usually 6 to 12 hours, so you can take it just before going to bed and you should go to the washroom the next morning. Side effects are abdominal pain and discoloration of the urine. Stool softeners are usually well tolerated, so like our docosate sodium, those onset can be 12 hours to 72 hours, so at least 3 days. They're well tolerated, they're mild, and they do work to keep the stool soft. Then there is the enemas. Enemas can be phosphates or mineral oil enemas, and those work pretty quickly. They usually come with an applicator and the liquid in the bottle that's attached, and then you insert it into the rectum, get the fluid up into the rectum, and within 5 to 15 minutes it works. So these are just some of the laxatives that are out there for you guys. Remember to speak to your pharmacist or your healthcare provider before choosing a laxative, and remember to like, comment, subscribe if you want to see more health videos. Thank you. Have a good day. Bye.